Thank you for coming today to our Virginia Beach Town Hall on opiate abatement. Today is International Overdose Awareness Day, so this is a wonderful day to be having this discussion. I'm Eileen Smith with the Department of Human Services. Just a couple housekeeping things that I'm going to go over with you. Take your break whenever you feel like you need to take a break. We are going to have some box lunches that will come into the room. And feel free to get up and get your lunch at any time when you're ready to. We're not going to put a break into today because we're from 11 to 1 for this event, and we want to maximize our time. We have a wonderful and very large panel of experts here to talk with you today. It is my great pleasure to introduce my boss, Dr. Ken Chandler, who is a Deputy City Manager for the City of Virginia Beach. And he is going to come up now and speak to you a little bit about today.
Well, good morning, everyone. Good morning, everyone. Yeah, that's what we normally get when we're in Virginia Beach. Again, it's always great to follow Eileen Smith, our great director, and we really appreciate you all being here today and would like to welcome you to this event, occasion, and unique opportunity. And we appreciate the partnership that we've had with the Commonwealth of Virginia to get to this point and look so much forward to your participating. So again, on behalf of our City Council, our Mayor Bobby Dar, our council members, our City Manager Patrick Duhaney, and our Human Services staff who are always present and serving, and this illustrious panel that you'll get to hear a chance to hear from today, we welcome you and really appreciate the time you've taken out of your schedule to be here with us today, and hope you're plugging in and get a chance to enjoy and get a great benefit from today's interaction. Thank you.
Good morning. That's the energy we need today, right there. My name is Angie Hicks. I'm the Deputy Director for the Department of Human Services, Behavioral Health, and Developmental Services Division. I would like to also welcome you here today. We are together despite the weather this morning in a unified, common mission, and that is to save lives. So it's nice that we can come together and see each other, but the topic of today is extraordinarily important, I think, to everyone in the room. So I look forward to the conversation that we're going to have. It is my privilege to introduce our panel of experts and our moderator for today. First, I would like to introduce today's moderator, Grant Neely. Mr. Neely is a managing partner with SIR, a strategic management consultant agency. He works with organizations to solve today's complex issues and develop successful plans for their future. He is a member of several important organizations and is a strong advocate on the causes of poverty, healthcare, homelessness, and addiction. On our panel today, we have Rick Baker. Mr. Baker is a brigade chief with Virginia Beach Emergency Management Services. He started as a volunteer in 1996, and he continued to advance his training and his certifications, which ultimately led to a position as a career paramedic in 2008. He was promoted to captain in 2013, and then promoted to his current position as brigade chief in 2018. Jennifer Basso. Jennifer is a registered and certified peer recovery specialist with the Virginia Beach Department of Human Services. Since 2017, Ms. Basso lives in long-term recovery. She maintains her stability and sobriety, and she shares her lived experiences with others to offer hope, encouragement, and support. She is currently the vice chair of the Region 5 Recovery Advisory Council. Shelby Giles is a clinical services administrator for the Virginia Beach Department of Human Services. And since taking on the role in 2014, she has overseen multiple behavioral health and substance use programs She has also ushered in new initiatives to enhance awareness and treatment opportunities in our community. Ms. Giles has 35 years of behavioral health experience in both the public and the private sector. Thank you. Doing a lot of talking, I guess. Next is Tony McDowell. Mr. McDowell was appointed as the first executive director of the Opioid Abatement Authority in August of 2022. He spent more than 30 years in public service, including a 25-year career in Henrico County, serving as fire chief and deputy county manager. James Patterson joined the Virginia Beach Department of Human Services as a certified peer recovery specialist in September of 2022. His recovery journey began in February of 2002 when he broke away from the pattern of substance use that he had experienced for over 20 years. Now, Mr. Patterson uses his experiences of incarceration and addiction and the struggles that he faced to help guide other people towards their own recovery. Dr. Caitlin Padati. She is the director of the Virginia Beach Department of Public Health. She began her career in public health at the Centers for Disease Control and Prevention in the Epidemic Intelligence Service. She is a board-certified pediatrician and a fellow of the Academy of Pediatrics. She has peer-reviewed publications and is also a member of the Gold Humanism Honor Society and the Delta Omega Honorary Society in Public Health. Amanda Pine. She is a Christian Faith Formation Director at Kings Grant Presbyterian Church, and she is also a co-chair for the Interfaith Alliance at the Beach. Many of you are probably familiar with this organization. We refer to it commonly as the IAB. It is a coalition of nonprofits, faith communities, and government organizations. She is also a certified Christian educator and certified in community organizing and congregational leadership. Bless you. Captain Jeffrey Wilkerson. He is a 29-year veteran of the Virginia Beach Police Department, where he serves as commanding officer of the Special Investigations Bureau. He is a graduate of the Federal Bureau of Investigation's National Academy and the Senior Management Institute for Police. And we also are proud to mention that he is a veteran of the United States Army Infantry. I would like to thank our moderator for being here today, Mr. Neely, and all of our panel members who took the time out of their very busy schedules to share their knowledge, their expertise, and help engage with us, educate us, and have a meaningful conversation today. And with that, I will turn it over to our moderator, Mr. Neely, for his opening remarks.
Well, good morning, everyone. We have a lot to do today. Before we get started, I want to acknowledge also Delegate Ann Farrell-Tata, who's joined us. She's a member of the House of Delegates representing the city of Virginia Beach. She, like everyone here, is somebody who is choosing to be here today. Doesn't have to be here, chose to be here. Her family's been involved in public life in Virginia Beach for a long time, and I just want to say welcome. Thank you for being here. Let me start off again by saying Happy International Overdose Awareness Day. I honestly didn't know that was a thing until I got here this morning, but that's why the Virginia Beach team picked today to have this event. We're here for a lot of reasons today, but most of all, we're here to talk and to listen. But before we do that, I think we need to have an honest conversation about why we're all here. And the truth is, we're not here for happy reasons. We're here because all of us, in some form or fashion, have been affected by opioids. Um, and in talking to folks this morning and over the past several days, I've really come to see that everybody is only about 1 degree away, sometimes closer, from folks who have really dealt with pretty intensely, the negative effects of opioids. In my own life, I've taken them. I've taken OxyContin after well, honestly, fell down a couple years ago in a high-speed running accident, one person involved, and I fell down, and I broke my wrist, and it was super painful. And I had to have surgery. First time in my life, in my mid-40s, this happened, and took a couple days. I got the procedure done, and they gave me OxyContin. And two things happened. Number one, really helped with the pain. But after just a couple of hours, I knew something about opioids at the time. I knew it was something I needed to pay attention to, but I wasn't really well informed. And so as I started to feel the pain subsiding, I also started to think, ooh, I'm feeling kind of funny. I got to pay attention to this. Unfortunately, I had that experience, and I knew up front what to listen to, what to look out for, and what to pay attention to. A couple years later, my mother, then in her mid-70s, had her knee replaced, and she took the same medication. And she had a different pain experience, but she also said, the first minute she could, I want off of this medicine because I can tell something's not going to be right. Well, we got lucky because we had that experience. But after that experience, I started paying closer attention. I started studying what this is and why it matters and why there's such a problem in our country. And when I studied it, I learned some numbers that are really pretty scary. 10 million people have struggled with opioid use just in the past year. And what is 10 million? Is that a lot? And it's a big number, but what does that mean? What it means is every single person who lives in Virginia, from Virginia Beach to Washington, D.C., all the way out to the Tennessee border and back. And then you go south down to about Raleigh. It's everybody in North Carolina east of there. That is a huge number of people in this country. Some 750,000, 760,000 people have died from drug overdoses since opioids have really become available. 75% of those are just connected to opioids. And to break it down really intensely, in Virginia, about 5 people every day lose their lives because of opioids, including 4 people just in Virginia Beach just this past weekend. And in fact, I've heard it say that more people die from opioid use than from any other natural cause put together. But bad news, obviously. It's important to know that Virginia and all of our cities and counties do a lot already to deal with this problem. We know from these numbers that it's not enough, and that's one of the things that we're going to talk about today. But Virginia operates behavioral health facilities together with localities. We run community service teams. We have departments of health. We have great hospital companies like Centera all over Virginia working on this. And we are in the process as a state and a country of having a new tool, relatively new tool, in place for a couple years now, through something called the Opioid Abatement Authority. And we'll hear in just a moment from the person that runs that. But let's talk about what that is. The companies that make these medicines have been sued over the last number of years because of all these problems and because of these numbers that I just laid out. And over time, they've said, okay, we don't want to go through the court system. Let's work out a settlement. And so a huge amount of money has been set aside by the companies involved in this business through settlements negotiated with state governments around the country. I don't know what it means around the country, but here in Virginia, it means a little over $1 billion is going to be coming into the state over the next number of years to do new stuff to help deal with this problem. And there's a team of state leaders, there's a team of leaders from around the state who are in charge of making sure that those dollars are used wisely and effectively. They've set out a whole series of rules for how that ought to work. And the next step is for communities around the state to go apply for that money so that they can do new stuff in their communities. Now, how does all that work? Well, it starts with events like this. And so here in Virginia Beach, in particular, and across Southampton roads, the cities together are in the process of putting together a whole series of forums like this to get together with folks that care about this issue, ask some questions. What's working well? What's not working so well? What are the gaps? What would you like to see different? And then they're going to take everything that gets said today and in these other several dozen forums that are happening over the coming weeks and write all that down and ultimately come up with a plan to submit to the state to do new stuff to help people who are wrestling with opioids. So that's what we're here to do today. That's our goal, is to help inform the writing of that plan. But the only way that plan is going to work, the only way it's going to lead to new services that make a difference for people, is if the plan is built on what people are looking for. So we're here today to ask those questions of everybody that's in this room. We're going to take that information and we're going to use it to shape this application. We're going to take to Virginia, get some money for our community, and start to do new things. Now, I start off by saying, look, we're not here for happy reasons. So let me just kind of try and set out some guardrails for how we want to conduct this conversation today. Most of all, this is about the team listening. That means you can get up and say whatever you want. There are no rules around that. If you've had an experience with opioids among people you love, among your family, or even personally, and you want to talk about that, that's why we're here today. Please do that. If you've had that experience and you want to share that, but you don't want to necessarily stand up in front of a crowd, that's cool too. So everybody's got sticky notes on your tables. There are pens in your bags that you got when you came in. You want to write something down, do that. And you don't have to put your name on it. You can if you want to. But a couple times throughout today, our team is going to come around and collect those. They're going to put them on these signs around the room so we can start to organize it. But everything that gets said or written or communicated or shared today is going in some fashion into the plan that Virginia Beach and Portsmouth and Norfolk and Suffolk and Chesapeake are all putting together for Hampton Roads. Now, I also know, because we're not here for happy reasons, that when you get up to tell your story, it might be painful. That's cool. It's fine. Whatever you want to say, however you want to express it, do it. And I would ask everyone else in the team, everyone else in the room, to be respectful of people's experiences. I would also ask, respectfully, to remember that one of the ways that's going to make today really successful is when we hear from as many folks as possible. And we got, I can't quite tell how many people are here. Something about 125 had signed up before today. So just, I would ask you to be respectful of that as well. And mostly, I'd ask you to tell the truth. I'd ask you if something's working well, please say that. Our teams at work in community services and public health. They don't have a lot of folks that say thank you. So if something's working well, please say that. But mostly we're here to find out what are the gaps that need to be filled. All right? That's what we're going to do today. Everybody's cool with that? Excellent. All right. We're not here for happy reasons, but it doesn't mean that everything's broken. So I want to start off by asking a question from our panelists, and we'll see where the conversation goes. And throughout the morning, we'll give everybody the opportunity to speak. Everybody's cool with that? All right. Before we jump into my hopeful and optimistic question, I do want to turn over to Tony and Stacy, who are going to set out in a little more detail exactly how all this works, exactly what the Opioid Abatement Authority is, exactly what the Commonwealth's role, what is the role of state government, what is the role of Virginia Beach and the other cities in Southampton roads, kind of some of the parameters around how this new money will be spent, and then we'll open up for discussion. Is that cool? All right. With that, I will stop talking. We'll turn it over to our panel members, and we'll get going from there. Tony and Stacy, y'all are next.
Good morning. So I'll know that I'm not doing a good job if people are getting up and grabbing their lunch while I'm talking, but actually it's fine. If you feel like grabbing a box, then please feel free to do so. I'm going to try to be sort of brief with my comments because the idea here is for the folks who are attending to have the chance to speak and for us to listen and try to answer your questions. But a little bit of background, my name is Tony McDowell. I'm with the Opioid Abatement Authority, which is housed in Richmond. We're a statewide entity created by the General Assembly a couple of years ago. We just opened our doors a year ago to manage the proceeds of civil lawsuits, companies that have settled with Virginia and with other states, their liability in cases where they've been litigated against for their role in the prescription opioid epidemic. So this includes companies that were involved in producing opioids, distributing them, pharmacies, marketing companies, and so forth. And so the first slide gives you a little bit of a history of how we got to this point. So back in 2007, a group of executives from Purdue Pharma were convicted on criminal charges down in the southwestern portion of Virginia in Roanoke. And that was kind of the beginning of the collapsing of the house of cards that Purdue had built. Have any of you guys read Dope Sick or seen the series on Netflix called Painkillers? So true stories that sort of dramatize what happened with Purdue, but there's other companies involved as well. And over the course between 2007 and 2020, every state in the union filed lawsuits against these various manufacturers, producers, distributors of prescription opioids, as well as their companies that are in their supply chain to get those drugs out onto the street. States filed lawsuits, but so did cities and counties and other local governments across the country. And by 2017, there were over 3,000 lawsuits pending in state court and federal court. And ultimately, all of these cases got combined into one massive case, different defendants, but all being litigated in one courthouse in the Northern District of Ohio, in Cleveland, Ohio. And one of the first things that the judge told all the defendants is, you're not going to prevail. So start talking settlement. And that's what they've been doing ever since, is working on what the terms of the settlements would be. And you have to understand a little bit about how this works. The companies that are being sued negotiate with the plaintiff's attorneys, which is state attorneys general and private outside counsel, and they negotiate what a settlement would look like, what a settlement deal would look like nationwide. And once they have kind of a structure of a deal in place, then each state has to decide whether or not they want to participate in the national deal. And you're either in or you're out. And in order for state to be able to participate, it has to also get its cities and its counties to agree to it. Because if you're one of these companies that's settling these lawsuits, you don't want to just settle with the state. You want to settle with all the public entities that are suing you. So in Virginia, when the first couple of cases were taking shape, the Attorney General had to reach out to our 133 cities and counties across the Commonwealth and see if they would be willing to go along with the deal. And long story short, the cities and counties wanted to negotiate, if the deal comes through, how much money will they get? How will the money be distributed? And so there was this negotiation that occurred inside Virginia between the state government and between the cities and the counties that make up the Commonwealth to arrive at an agreement that all the cities, counties, and the Commonwealth would agree to. And that agreement determined how the money would be allocated within the state of Virginia. And it's important to understand that background in a minute when we talk about how the money can be allocated and where it can go and the percentages and that sort of thing. In 2021, Virginia moved to the point where it was prepared to accept the settlement offer. As part of doing that, the deal that I just described to you was then put into statute by the General Assembly. So not only do you have a written contract or a deal between the state and all the cities and counties, but you also have a state code that really enshrines that deal into statute. And then as plaintiffs in this case, the state and all of our 133 cities and counties had to go to a state court to release any claims in state court and to release those claims and to accept the deal that was being offered by the first group of companies that were trying to settle. So pretty complicated, a lot of moving parts, but just the point here is to understand that there are very specific restrictions on how the money can be shared, how it can be used, and that's not something that my board of directors makes a decision about. It's state code, it's written agreements between the state, the cities and counties, and it's a court order through the Richmond Circuit Court. So as a result of all that, who can receive distributions from the settlements that are coming along? The state can, cities and counties are able to accept the funding, and this is where I have to make a distinction. It has to be a city or a county. Can't be a town, can't be a school district, can't be a community services board. It has to be basically a publicly elected city council or board of supervisors or state agency. So in Virginia, those are the only entities that can receive these funds directly. Now, you might be from a hospital system or a service provider like a nonprofit or a for-profit or a doctor's office that is doing great work in this space, and you're making good use of the money. The very few dollars that have been available to this point, you've been able to stretch them and make the most of them. And so it might be frustrating to hear that you can't apply for these funds. But it's critical to understand that you can still work with state agencies, you can work with cities, you can work with counties to offer your services, because in many cases, these cities and counties are receiving these funds and they're looking for partners to execute their programs with. Another way of looking at how the funds are distributed is according to this pie chart. And you'll see that the blue section of the pie is 30% of the pie. So this is a pie that represents all the money coming to Virginia. And as it was mentioned, we're looking at a little over $1.1 billion over the course of 18 years. So it's paid out in increments over 18 years. We've already received the first 3 payments, so we have 15 more years to go. And of each dollar that comes in, it's divided into one of these 3 pieces of the pie. The blue slice is 30%. That money is set aside and provided directly to the cities and counties. They get that, the cities and counties get their share directly from the courts. It does not come through the state government, does not come through the Opioid Abatement Authority. Every city in Virginia, every county in Virginia has already received the first 3 payments from the first settlement. And on our website, you can see the exact amounts that have been distributed. 15% goes basically to the state government, where the governor and the General Assembly can appropriate those funds using the normal state budget process. They can only spend those funds on opioid abatement purposes, okay? And then 55% comes to the Opioid Abatement Authority, which is my organization. And what we do is provide grants to cities, counties, and state agencies in order to carry out efforts to abate the opioid epidemic. And we try to oversee how all of the funds are being used statewide, provide that information back to the general public, to the General Assembly, and to other elected bodies. So let's talk a little bit more detail about how the OAA divides up grants to cities, counties, and state agencies. Of the funds that we control, of that 55%, 15% is set aside for the cities and counties, and there's a specific formula that shows exactly how much down to the penny each city and each county is entitled to receive from us. It's basically their money. but we hold it until they come to us with an application, and the application says basically, here's what we want to do with the money, and they have to prove that it's being used in accordance with our requirements. We require that the money only be used for efforts to abate the opioid epidemic, so prevention, education, treatment, harm reduction, recovery supports. It's a pretty broad list, but it can't be used to buy police cars or to fill potholes or, replace the roof on a community center. It has to be used for efforts to help the sick and the suffering from the opioid epidemic. So that amount is non-competitive. Each city and each county has an amount that we're holding for them, and they can apply for those funds. And if they have an idea how they're going to spend it, and they're willing to commit to that idea, then we will release those funds to them each year. If they don't know what to do with the funds, we'll hold them for them for at least 3 years. And so that's a little bit of the situation that we're in right now across Virginia. Most cities and counties in Virginia have not yet applied for these funds because they're trying to develop ideas of what they want to do with it. They're trying to build strategies. And so really kudos to Virginia Beach and the other cities in the Hampton Roads area that are having this sort of forum where the people who've been impacted by opioid use disorder and by addiction and substance use can come forward and share their experiences with the decision makers. So that's the first 15%. 35% is set aside for us to provide funding to regional cooperative partnerships. And this is where multiple jurisdictions work together to develop a program that serves their entire geographical area. And we're really trying to incentivize a regional approach, because if you're a person who's sick and suffering from substance use disorder, you don't want to hear that you're on the wrong block of the street to get services. And if you go 2 blocks down and you're not in this city or in that city, then you can get services, but you can't get them here. So really there's this idea of trying to, substance use doesn't respect borders, right? And so we're trying to encourage more of a regional approach. And those grants are competitive. And so we're looking for the best value for the money, and we're looking for the things that will have the biggest impact on substance use disorders and opioid use disorders in the Commonwealth. 15% of our funds can go to state agencies, and that's not necessarily just executive office agencies. It also includes the courts, it includes universities, it includes independent state agencies. And so that is another opportunity for us to make a difference. And then 35% of our fund is unrestricted, which means that our board can provide additional amounts of funding into the other areas I've already described, and we can come up with specific targeted grants for specific programs. And so I'm here as much to listen to you and understand what the needs are as I am to explain how this works. Now, you might be wondering specifically for Virginia Beach, what does this allocation mean? So the amount of money that has already come to the city of Virginia Beach directly from the companies that have settled is listed on this chart. And the amount from 22 to 23 is 1.7 million. And then as you look forward through 2032, it's approximately $300,000 to $500,000 a year for those years. And then from 2033 to 2039, $375,000 a year. Now that's from the known settlements. And there are 2 known settlements so far. There's 5 more that are almost finished. Those 5 include some names you may have heard of, like Walmart, Walgreens, CVS. So these are retail pharmacies that were litigating against nationally to defend their practices and their contributions to the opioid epidemic, and Teva and Allergan. And all 5 of those settlements are very close to being finalized. We think the amount of money that you see on this slide will actually double as those come through. Now, the individual distribution to Virginia Beach, that's the money that the OAA is holding for Virginia Beach, that they have to apply for, is approximately 2.6 million in total between now and 2039. And again, those numbers could go up significantly as more settlements come through. And then distributions for cooperative projects involving multiple cities or counties, the money that we're providing for those regional efforts. Right now, Virginia Beach is cooperating with other cities, including Chesapeake, Norfolk, Portsmouth, and Suffolk, to open up a behavioral health unit, a crisis unit in Chesapeake. And in addition to that, the cities were awarded a $50,000 planning grant from the OAA to come up with an overall community-wide strategy for the Hampton Roads area. And this is what is happening today in Virginia Beach is part of what that effort was trying to fund. So, um, again, I'm trying to move forward. I got one slide left for you. The question probably is, how can the funds be utilized? This language comes directly out of the state code. The money can be used to treat, prevent, and reduce opioid use disorder or the misuse of opioids, or otherwise abate and remediate the opioid epidemic. The funds have to be conducted, or the efforts have to be conducted or managed by an agency of the Commonwealth or a participating locality, which is the cities or counties, should not be used to supplant funding, which means if a city is already spending money on an effort and then we give them more money, they can't take the money they were already spending and put it into something else and backfill it with the money we gave them. They have to build on how they're already investing their own funding. There's no indirect costs allowed, so that basically just means you can't play a shell game with the money. And then the recipients are required to provide the authority with information about the implementation efforts and to allow us to monitor those efforts over time. So that's a real quick overview of how the money comes from these national settlements to Virginia, to individual communities, cities, and counties. And I'll turn it over to Stacey O'Toole from the City of Virginia Beach to provide the rest of the story on this. Stacey.
Thanks, Tony. I'm Stacey O'Toole. I'm the Behavioral Health Director here in the City of Virginia Beach with the Department of Human Services. And I've been part of the planning team on what we're going to do with our opioid abatement funds. So as part of that planning process, we gathered a lot of community stakeholders. So we met with public schools, we met with the sheriff's department, we met with police, we met with public health, and you can see the list of the folks that we talked to. And we're here today because we want to talk to the community, the citizens, individuals impacted by opioid use disorder, individuals who are working for private entities that may want to be part of our stakeholder group in this process. So that's why we're here today. And before I go into some of the strategies that have come up based on our stakeholder discussions, there is lunch back there. And so I will not be distracted if you want to stand up and get your first choice at whatever sandwich is back there. So please make sure you grab a lunch before you leave. And I'll go through some of the C. I knew people would be interested in lunch. But some of the strategies that we've already talked about using some of our abatement money for is a new peer drop-in center. So we are looking to provide a place where individuals who are in recovery can provide a safe, sober environment and sober supports for individuals who are new in their recovery journey. So we're really excited about building that program out at our Pathways Center facility out on Bird Neck Road, kind of around the corner from where we are right now. We also were looking to add some treatment services in the Virginia Beach Correctional Center. We are looking at doing a lot of prevention and education initiatives. So we're looking at some evidence-based curriculum that we can provide through the schools and the rec centers to help educate kids and their families so that we don't have to treat them later. Educate them on how to recognize what they're encountering and how to avoid using opiates in the beginning. We're looking to add peer recovery services. You'll see lots of integration in peers, recognizing that that's such an integral component in the treatment process. We have 2 peers on the panel. That's how important peer recovery services are in our continuum of care. So we're looking to add peer recovery services to our drug court program. We are looking to add peer services to our Restore program, which is our medication-assisted treatment program for individuals with opioid use disorder. And the last piece on this slide is a safe respite program in partnership with social services to help provide respite homes for families that have been impacted by opioid use disorder, and they may need a safe place for those kiddos to reside while their caregiver is getting treatment services. Some other initiatives we have on our chart here is neonatal abstinence syndrome initiative, which we're working with the health department on that piece. Dr. Padati, as a pediatrician, is a firm supporter of that idea, but that is to work with the families who may be caring for babies with neonatal abstinence syndrome, but also to work with the medical community, obstetricians, pediatricians, so that we are able to provide education on the needs of those babies. We're looking to do some community events to raise awareness in the city of Virginia Beach. We're also looking to put some funds towards first responder training, recognizing that our first responders, we've got some on the panel today, are boots on the ground, often the first people to encounter individuals in an opioid crisis, and want to ensure that they have all of the resources that they need to be able to support those individuals. We met with peers. I've mentioned peers a couple times. We met with peers as one of our stakeholder groups and said, talk to us. Tell us what were challenges when you were entering in your recovery journey. What may have made it difficult for you to stay on that journey? What may have contributed to relapse? And one of the common themes that came up were lots of barriers that we can apply money to help eliminate some of those barriers for individuals. Things like helping to pay for vocational training, scholarship programs, pay for a rent deposit, or get somebody's lights turned on, those kinds of things. That we would like to be able to use this money to help support people who are in their recovery journey. And then we carved out a piece for Tony. We carved out a piece knowing that we would be applying for some of our for regional partnership collaborative grants, and we wanted to make sure that we had some money in reserves in order to provide a match as part of that planning process. So those are some of the strategies we've already been talking about, but we know that we don't know all of the gaps in the community, and so we're here to hear from you all as to what you think we could do to help enhance opioid treatment and recovery in the city of Virginia Beach and in Hampton Roads. And that is the end of my presentation. But before I go, I did have a staff member tell me that despite our best efforts, we have a slight error on a phone number on your agenda. So our peer recovery warm line number, the last 4 digits are 6190. 6190. The information in your bag that also has warm line information, that is correct. But on your agenda, it's 6190 to access our warm line. So again, don't forget lunch. And at this point, I'm going to turn it back over to Mr. Neely to guide our conversation.
Great. Well, thank you, Stacy and Tony. As you can see, they both have big jobs. Tony is in charge of administering this program for the state, and that means that ultimately he's got responsibility for making sure that money that we all own together, we have all received together as Virginians, gets used wisely, and that as many dollars as possible get dedicated to services. We were talking earlier, he gave me his business card. He said I printed it myself because we're trying to save money on anything they can find, and that's a good thing. And Stacy and her team are ultimately in charge of services, doing the work. As I said earlier, a lot of folks in this field don't get a lot of gratitude, but they are professionals and they do great work, and we want to thank them for that. That's a lot. These are complex roles, and I'm not sure that I've followed quite every little piece of Tony's presentation because there's so many different buckets of money that are used for different but similar things. But all of it is ultimately going to be used for people and for real services. So I thought we'd start off the conversation this afternoon by talking to one of our hearing from our peer recovery specialists. So I want to start off with Jennifer Basso. A, because she's great at this, and B, because we happen to be sitting next to each other. But Jennifer, can you tell us your story? Tell us what it means to be a peer recovery specialist. How'd you get into this? And then tell us what makes you optimistic about this work.
Thank you so much for the question. So my name is Jennifer Basso. I'm a registered and certified peer recovery specialist with the City of Virginia Beach. What that means to be a peer recovery specialist is you have to have lived experience with mental health and/or substance use disorder. I like to say I'm a double winner, so I have both. I spent 26 years in active addiction, and since 2017, I've maintained stability in my sobriety and my recovery. I claim my active recovery date as of May 26, 2019, though, because the first year to 2 years of my sobriety was really just learning how to function without a substance. I didn't even know that peer recovery specialist was a thing. So once I got sober, I just wanted to help people in any way, shape, or form I could. And through getting involved with community stakeholders, I found out about this position. I took the class, got certified, and here I am sitting on a panel getting the opportunity to talk to everyone in this room. What gives me hope is every single one of you in this room and on the live stream right now, and optimism, because I think we're finally at a point where people are really listening and people are really understanding that substance use disorder is not a moral failure. It's not a problem or a character defect that you have to fix, it's a disorder. And a lot of it is exacerbated through stigma and feeling that we can't share and that we can't tell each other our struggles. And that's what keeps a lot of us in isolation and addiction. So each and every one of you in this room that put the time and effort to plan these events and to ask for our opinions, because James and I were in the meeting that Stacy just referenced, asking what could have helped us in our recovery. And the support and encouragement that we get from this organization is unmatched. So that's what gives me optimism. Thank you.
Cool, thank you. James Patterson, could I ask you the same question?
Hello, everyone. My name is James Patterson, and I came to the city of Virginia Beach from by way of New Jersey in 2001. And prior to, I had struggled with addiction for many years, and as a result of that, I spent many years in and out of institutions, and I never could find my way. And I moved here, and my sobriety date is 2002 of February. As a matter of fact, 26th of February is my sobriety date. And who would ever figure that the very same facility that I got cleaned and I now work in. And so I'm honored. I like to say to my coworkers and my supervisors that I'm here to do the work of the people. The politics and the other things, you guys can keep that. I boots on the ground. I love to interact with people. And I think that that's not to say that anybody else's job is more important than anyone else's, but I speak the language of the people. And I identify with their needs and wants and their struggles. And so I struggled at one point with the whole idea of doing peer recovery work because I was a business owner for 20 years. And, you know, all I could see was the pot of gold at the end. And then I had this premonition one day that my latter years should be spent purposeful, trying to do things to make a difference in the community. And I think if I keep that in front of me, then I can be effective in trying to reach people. I want to say that now is the time. We've been normalizing addiction for many years and kind of, you know, turning the other way. And this is not something that just started. I'm almost 60 years old and I've been dealing with this for over 30, 40 years. So it's not anything new. But I think we need to just try to take a different approach to it, you know, because I said a couple weeks ago in an interview that we've all been affected directly or indirectly in some way or another. And we can no longer, society as a whole likes to normalize new things. And this is one of the things that I don't think we can afford to normalize, because we got more and more generations. I'm seeing them younger and younger. And so if we want a future for our grandchildren and our children, the time is now. We need to bring all our resources and set aside our petty differences and things of that and try to save lives. So,
Cool, thank you very much. Let me ask another question of our first responders, Rick Baker and Captain Jeffrey Wilkerson. Tell us about your experience interacting with folks who are experiencing opioid use disorders on a day-to-day basis, your teams. What do they see? What do they experience? What do they face?
Well, out in the field of EMS, I've seen people from all walks of life that have been affected by this. We're usually there at their worst moments. We're trying to bring them back from the brink of death, literally. As opiates affect people, it stops their breathing, which in turn will stop their heart. That's what we're trying to reverse. We only get to see them in that brief instant at their absolute lowest. We do our best to get them to medical facilities so they can get treatment to fix what's going on right then and there. But that's all that most of the time I get to see. Now, I also teach Revive, which is part of the program that helps to teach lay rescuers the use of the reversing Narcan, naloxone, however you wish to say it, to revive people before they get to that state. Okay, that is, and as I said, we see people from all walks of life, all ages. It can be prescription drugs, illegal drugs, it doesn't matter. It's out there everywhere.
And everyone, thank you for the question. Law enforcement sees very similar circumstances as EMS. We're the first responders there. We often see people at their lowest point in their life where they've succumbed to an opioid overdose. I would tell you that the patrol officers in Virginia Beach, all of them have Narcan available. They use it unfortunately frequently, and they save a lot of lives. But we go beyond just the initial response in law enforcement. We try to abate opioids at the source. So in my bureau in special investigations, I have a lot of detectives who are trying to find the sources of distribution. So we take that initial call from the patrol officer who hopefully has saved a life, and we try to gather information at the scene and follow up in an investigation to find the opioid distribution at the source. Unfortunately, some of the, as you know, the victims of opioids don't survive. And unfortunately, in the city of Virginia Beach, we've had 12 deaths related to overdose in the city in the month of August. And we've had 39 documented opioid overdose cases in the month of August. So it is a growing call for service for us. It has an impact not only on the victims and their families, but it has an impact on officer wellness because of the exposure. So we see all walks of the opioid crisis in law enforcement, and hopefully this gives us an opportunity to bring all those things together and work on a joint solution.
Cool, thank you. Dr. Padati leads the public health department here. Tell us what that means practically.
Yeah, so maybe I could share a little bit about public health in general for anybody who doesn't know us, and then kind of talk about how I think we've helped, but maybe, opportunities for us moving forward, which of course are informed by discussions like this. So a lot of you probably know public health through the COVID pandemic, asking you to get vaccinated and wash your hands and do all those good things, and we do that, right? And we will still do that. But we have a lot of other roles too, right? So we have some things like regulatory authority around inspecting restaurants and permitting pools so you can be safe and have fun. We do things like provide vaccines for children, which we've been doing a lot over the last couple of weeks, getting our Virginia Beach kids back to school. We do stuff like screening for things like STIs and tuberculosis. And we do things like working, of course, very closely with our city partners to prepare for emergencies, whether it's a hurricane or anything else. But we also have a great group of people throughout the health department who do things around health education and outreach. And many of you, I can see a lot of our friends in the audience today. Many of you have probably worked with them. In fact, we've got a couple of them here today. And so that is one of the ways that the health department helps support public health issues like this, right? So we can help provide education, we can help connect people to some of the resources that do exist through things like our Human Services Department or others in the community. And we also work really closely with our EMS and law enforcement partners for things like distributing naloxone and helping provide that training in the community. But some of those things, I would say as a public health professional are further down the line, right? We're trying to address a problem that already exists when it's really gotten to a crisis level, as we heard, from our EMS partners, right? We're really trying to address somebody when they're right at the edge. And in public health, that's never where we want to be, right? We want to be on the preventive side. We want to get closer to the work that James and Jennifer and other people do to help prevent people from being in those situations. So, when I think about opioid overdose prevention and some of the challenges, for us, together in Virginia Beach, I'm struck by the way that we approach this differently from infectious diseases, right? We were talking about measles, we would be calling this an outbreak. And I think that, truly when we see increases like this that we're hearing from our law enforcement partners, it signals to me that we need to keep doing a lot of those, what I'll call tertiary interventions, things like naloxone when we've got people in those crisis situations. But ideally, we really want to get to those preventive activities, right? The equivalent of a vaccine that will protect people so that we don't find ourselves in these situations. But that's a lot harder to do, and I think that's why, conversations like this are so important because that looks different for different people. And so, hearing from everybody in the community what that need might be, I think is so critical.
Cool. Thank you, Dr. Badati. Ms. Giles, tell us what it means to be a clinical service administrator and how your work directly affects people. You do a lot of behind the scenes work, right?
Good morning. I would have to say that in my role, I have an opportunity to serve our community with individuals struggling with mental health disorders, with substance use disorders, and often they're overlapping with co-occurring disorders. And I am here today because I think this is an opportunity to exchange information. I want to hear from you all today. This is for you because we work very hard and we have a lot of resources and information from prevention to active treatment to recovery services that we provide in our department. But we want to see if we can identify any gaps or any opportunities, missed opportunities that we can help to fulfill the plans that we have moving forward with this funding. We want to be good stewards of this funding for our citizens of Virginia Beach. And so it's imperative that we receive your input today. And I am hopeful that this will be a very productive time and opportunity for us to exchange information. So thank you for being here today.
Cool. Let me ask one more question of our panel, and then we'll open it up for discussion among everyone here. Before I do that, if I got to ask all of our panelists, just as you're talking, be sure if you can lean into the mic to make sure that our interpreters in American Sign Language can get everything for folks who are watching the live stream. Amanda Pine, tell us about the Interfaith Alliance and what's the role of the faith community in the opioid issues?
Sure. Thank you for the question and thanks for having us. I think the Interfaith Alliance at the beach is so powerful because of its role connecting faith communities as well as nonprofits and our partnership with various government organizations. Faith communities are so often safe spaces and they're transformational spaces. So they're spaces where this work can kind of happen in a variety of ways. So the destigmatization work, talking about recovery from the pulpit, could be very powerful. Many faith communities already offer a lot of support. Maybe faith leaders are supporting individuals, but also groups, AA, NA, often meet in faith communities and then supportive existing programs that are out there. Providing prevention and education is something that faith communities can do. And also just being able to have that reaction. Many faith communities have an AED on their campus, just in case anybody should experience a health event during a worship service. So why not have Narcan? And I can tell you our church board has many reasons why not. But the IAB's role is to really work through those imaginatively of how can we provide sort of that safe piece to everyone in our neighborhoods. And since the faith communities are so prevalent, it does make sense that they would be locales where people can come just right down to their neighborhood faith community.
Thank you. The faith community plays such an important part in life in Southampton Roads and Virginia Beach, and for many of us in our personal lives. And I appreciate you making the point about a safe space and a transformative space, and we hope that's what folks are going to experience here today. So you've heard from all the members of the panel so far, and now I'd like to ask who here would like to share some thoughts. We'll go back to the rules that we laid out at the beginning. The fundamental questions are, what's working well? What's not working well? What are the gaps? How can they be filled? And as I said earlier, this is a safe space. You can say whatever you want. You got a statement to make, that's great. You got a question to ask, we'll try and find somebody that might have the answer. But now this is your moment. So we have a podium here in the middle. If you want to come over and speak there, that'll really help, again, our interpreters, because we have lots of folks who are watching this event on the live stream at home, or maybe some at work, taking a break. So I would ask you to go there. But again, if you have comments, thoughts, questions, and you don't want to raise your hand publicly, that's fine too. Write them down on these sticky notes on your table. Folks will collect them later, and then we'll keep going. Our first speaker, welcome.
Can I interject real quick? And also, if you're unable to come to the mic, we have people that have microphones that can come to you. So I just want you to know that there's multiple ways to get your information to us.
Excellent. So come to the podium, raise your hand, whatever is easiest for you. Yes, ma'am.
Good morning. Good morning. My name is Myra Payne, and I have so many emotions going on. I'm trying to settle myself, but I have worked for Virginia Beach Public School System and for Norfolk Public School System. And one thing that I think should be done is a suggestion is that I have worked with, I guess, assistant principals and principals accusing students of being impaired and for different reasons. And the students sometimes were expelled from school, or at least for one day, and their parents were called and they were picked up. So what I think should happen is that students who have been found to be impaired in our school system, that they are not just sent home, but they are referred to a program. Because if that is a problem, that's the beginning of the problem. And if they get sent home, then they get sent home to do it even more, not to stop. And so I think they're being put into an environment that would facilitate an increased use of drugs, alcohol, or whatever. So I believe that when students are found impaired, whether it's by the principal, the assistant principal, or a teacher, or the nurse, whoever's involved, that a program, they should be referred to a program, given opportunity to repair or to recover or to find out, do they really have a substance abuse problem, or is this something that we can take care of early. To me, this is part of prevention. And if we don't have this in the school system, or we don't even know it's available to us. Certainly, I never referred a child, but I know that even after I said the child was not impaired, they still were actually punished and maybe even expelled for 2 to 3 days. So I think that's for our school system. It's important for us to start however young these children are coming to school. But what I also found that when children come to school for students who parents perhaps are using marijuana, the children come to school smelling like marijuana. There's nothing you can do about it. They were in the car with them. They sleep, eat, and drink with these people who are using those types of substances. And then the children are penalized, maybe even when they were not even using the, substance. Thank you for this time.
Thank you, Ms. Payne. Can I ask you, did you work at the elementary, middle, high school level? Maybe all those?
Actually, I worked at all of them in Norfolk.
Got it.
Yes, so I was primarily assigned to a elementary school. And then as time proceeds, I have worked in all of those areas, and I also went to different schools, so in Norfolk.
And you observed this problem at all those levels?
Not so much at the elementary school, because they don't really say, because I think they realize those children are not using, that their parents have, that's a strong odor. Marijuana is a very strong odor. And so children come to school smelling like marijuana. And the problem I saw mostly was in Virginia Beach at the middle school I worked at, and where the students were expelled for being impaired. And I would even say they're not impaired. They may smell like marijuana, but they're not impaired. And they still were punished. And I had a problem with that. That's why I no longer work there.
Thank you, Ms. Payne. Who else?
Yes, good afternoon. My name is Earl Hamblett. I work for an agency. I'm also a resident of Virginia Beach, but I work for an agency called MASS. It's Minority Aid Support Services. Anyway, I do comprehensive harm reduction in the streets of Virginia Beach, Norfolk, and Newport News. And a lot of times I run into people who want immediate treatment. They want to be able to go to a detox. And I don't know what has happened to the detox centers in the area. I mean, there's nowhere to take them unless we take them to a hospital. One of your panelists benefited from a detox facility. And so I don't understand why we don't have an immediate place we can take people who need help. And this is a vital point. When people are asking us for help and we're not able to take them somewhere to get detox, it's bad. Also, I wanted to address this issue of barrier crimes for people who are seeking to become peer recovery specialists. I had this happen to me because of some crimes that were committed as an addict 30 years ago. I was not able to become a peer recovery specialist in the Virginia Beach area. Now, I don't understand how we can eliminate people simply because of something that happened 30 years ago. This is part of our lived experience. This is part of lived experience as a peer recovery. I'm able to communicate with people in the street only because I was there. I was there 30 years ago. So I think that issue needs to be addressed because peer recovery is a very good weapon to have, a very good tool to have when you're dealing with opioid addiction. The agency I work for recently received a grant from the Virginia Department of Health to do comprehensive harm reduction. And a lot of that involves needle exchange. And I know that some people don't feel good about the fact that we go in the street and offer free, clean needles to people so that they don't spread diseases. Um, I would love to see more CSBs come on board with that. The BHGs, the behavioral health groups, are doing a great job with accepting us and allowing us to come and talk to their participants, but still there's a reluctance on some entities in the city to, to accept comprehensive harm reduction, and particularly needle exchange. So I just wanted to make my thoughts known about detoxification centers. We need that. We need that, man. I don't know what happened. We used to have a detoxification center on Bird Neck Road where we could take people to. Norfolk doesn't have a detoxification center that you can take people to immediately. So thanks for allowing me to share that.
Cool, thank you, Mr. Chairman.
Good
Yes, ma'am.
afternoon. My name is LaBarbara Ecklow, and it's more of a question that I'm going to be asking for prevention and education. Are we going to be looking for any of these funds or any of this help by going into our homeless shelters, our colleges, our food kitchens, and the place where the at-risk population might be, and try to do prevention and education? And do we help these facilities that would have a need for assistance in filling out the application or doing whatever they need? So are we looking at things like that at this time?
Please.
Thank you so much for your question. I know right now, currently, myself and James and I are part of an outreach collaboration where we go out in the community and we meet people where they're at. So we're in the homeless populations, we're at, stopping at Pin Ministries and at all the food pantries, and we're trying to get out there. We work closely with the Housing Resource Center in Virginia Beach. So we are actively trying to get to the people that need the services. At this time, could it always be more? It could. If we could hire more peer recovery specialists and get rid of the barrier crimes, we could get more people on the ground. So thank you so much for your question.
Will the grant assist you with hiring more people to get out to? Because like you said, there's a population that we need to go out to them.
How much? But I know that there definitely is money and people on this panel that could speak to that, that we are trying to hire more people actively.
Okay, thank you.
I'd like to speak to that a little bit, just in regards to some of the outreach efforts that we do. I'm getting a little feedback, so I'm gonna step back a little bit. We do, as Jennifer was saying, work very closely with the Department of Housing and Neighborhood Preservation and their outreach team, our Path Homeless outreach team, and also our state opioid response peers. We try to do a lot of collaboration in the community to help people in need of these services and supports, and to, as she said, meet them where they are in the community. Mm-hmm. And so that's something that we've been doing routinely now, and we're having some positive outcomes with that. And we're going to continue to try to work in regards to having a collaborative efforts throughout the city strategically to help the population that are in need of these services. In addition to that, in regards to what you were saying, the prevention component of it, and someone else also spoke earlier in regards to prevention and education and some of the things that we're doing. We do work with our Virginia Beach City Public School System. We have our substance abuse intervention program at the Renaissance Center, where we work with those children that have been identified that may be struggling or dealing with a substance use disorder. This is an educational session in which we work with the children and also the parents through that program, which is a 2-week program. And with the OAA funding, we are looking to add additional prevention measures and efforts in place with evidence-based practice programs to get out to work with more schools and to work with the rec centers and to meet the children where they are in regards to prevention. So I did want to speak to that as well.
And I hear all of that, But I do know until you have, like the gentleman said, boots in the ground, boots in the community, because a lot of people don't have transportation, so you have to go out to them.
Yes.
My question stems from the fact that I saw the way the Virginia Beach Health Department managed COVID, and we went to the center. I'm a registered nurse by background. I have been a volunteer for 15 plus years. And I know that our most successful flu shots and everything stem from the fact that we go into those environments, and that's the way we have been able to get as many people inoculated as possible. So the question, once again, I hear all the funds, but do the people and the facilities where these people are housed, are they getting help to fill out the applications? Because a lot of these facilities and businesses don't necessarily know how to manage the process. You got the process in place. I think it's a wonderful process. But is it coming down to the people that need to know?
Yes, ma'am. Thank you.
Ma'am, can I ask you one question to make sure I understand? You said you're a registered nurse. You have worked with the Virginia Beach Health Department?
Been working with them since Katrina, yes.
Got it. And you believe that that team did a good job during COVID of getting,
Over at the
right.
convention, when they put it here, yes.
Got it. And so your recommendation is this team needs to do what they did to be able to reach more people?
If it's localized to that population,
Got it.
yes.
Cool.
Yeah.
Thank you.
You're welcome.
Who's next?
How are you? Name's Karen. I work with Penn Ministry out here at the oceanfront. I see a lot of my friends and coworkers. I have a history of working in this field of opioid use disorder, and there's a couple of things on my mind today, one of which is in one of the organizations with whom I worked, the employment was lacking in qualifications. I was 2 of 13 counselors actually certified to counsel. I think the law needs to change. My son is actually in that clinic. He's seen his counselor 4 times in 1 year. That needs to change. So beyond the funding and so forth, I'm talking more directly about the law. And then a young lady that just spoke, talking about our at-risk population of whom I work with directly. There is the biggest issue with our at-risk population who are active users of opioids or heroin or fentanyl or whatever the case may be, is their fear of being arrested. That's a huge fear. So what they don't do is call for help. We've lost 3 of our clients directly this week. 3 within 1 week. There was more before that. I'm just bringing it to the table because it happened just this week. 2 of them died because the person that was with them was afraid that they would be arrested. James, you talked about not normalizing it, and I agree with you. Opioid disorder should never be normalized, but it should not be for the user, the one that's afraid to call for help, the one that could have saved the life of another had he Narcan or what have you, would not be arrested because he called for help. Now, I know their laws are changing, and I'm not exactly sure what the law is today, but maybe we would have had 3 people with us today, and I could have encouraged them through our groups there where we work at Penn Ministry, through ODU's team that works in coalition with Penn Ministry, with education. We might still have had those folks with us today. Fear is a big deal with them out in the community. So I lost 3 clients this week, but over the course of the last month, I can count 1, 2, 3, 4. I can count 7 of my clients should have died. And the only reason one of them didn't is because the police happened to be patrolling that street. Her friend with whom she was using dipped because he was afraid. There's just some comments I wanted to put out there for boots on the ground folks like myself. And also wanted to address that opioid MAT systems are not up to snuff when it comes to true assistance. MAT is just an assistance to what the therapy really should be. That's just to help you stabilize in your craving. The real treatment is therapy. The real treatment is counseling. The real treatment is group. Those are the real treatments. And those of us who have been there, done that, we can tell you that's where the real help is. But there are some organizations that simply don't have it set up to where they even have qualified counselors on staff. But I just wanted to share that today. Thank you.
Thank you so much, and I'm sorry to hear about the losses of life we had just this week. Part of the state opioid response is to get out and provide Narcan to those that are still actively using. So if any City of Virginia Beach resident calls the warm line at 757-402-6190, myself or James or our other coworker will meet them anywhere in Virginia Beach. We'll talk to them, we'll provide them fentanyl test strips and Narcan. And during the process of explaining how to use the Narcan, we try to remind everybody that there are laws in place to protect you from getting arrested if you call to get somebody help.
That's awesome. So we need to educate we need to educate. We need to educate. And actually, that's what she and I talk about frequently, is the education of those that are at risk, and those are the users in the streets. There are many in the homes that are at risk also, but so much more when you don't even have the safety of a roof over your head. And I just wanted to bring that to the panel.
If I could just address the police response.
Oh, yes.
The laws have changed, and we are not arresting consumers, and we are not arresting
Okay.
callers. We are in the business of saving lives, and that's what we're doing. And that's why every officer has access to Narcan in the patrol division, and they're able to be first responders, and we are saving a lot of lives. What we need is a better communication system, because if your population is still concerned, we're here to tell you, please call us, because we are in the life-saving business. We want to help.
So again, this is about education sharing with the community. So I'm going to have that number posted in our offices so that they have that opportunity to learn that. And I am the recovery coordinator there, and that is something I'm going to bring to our groups when they do come, to make sure that they understand there is a level of safety. You're trying to save your friend, don't run, stay with them, and then make sure that they have that warm line. And you guys need to be a whole lot more of y'all, a whole lot more of y'all.
And I would just follow up that when we're there, we have access to services, and we
Yes.
try our best to offer those services.
Thank you so much for that.
So stay here.
This is great. That sounds like a really important connection that might not have happened if we had not had this meeting this morning. That's a great thing. I really appreciate you bringing up the point on Narcan and education. Am I correct, Virginia Beach team, we're going to be providing Narcan here today, later at the end of this session, as well as education about how to use it physically, but also like what the rules are around how to use it. So you got a few free minutes. It doesn't take long. Stick around at the end, and that's going to happen. I'm sorry, I didn't mean to interrupt.
No, well, we're going to stand here together. My name's Tina Gustin, and I'm a professor at Old Dominion University in our School of Nursing. And I'm going to offer a suggestion at the state level that we need to think about. So we've embedded ourselves, my ODU hat, at Penn Ministry, and have started a free and charitable clinic for those that are living in homelessness and receiving services at Penn. And we're there 3 days a week. It is an integrated behavioral health model with our social worker and our family nurse practitioner that leads the clinic. We have students from various professions there that are working in that team-based model and are really embedded in this community and understanding the community, which we believe is going to affect the way they care for individuals upon graduation. One, where they go work. Public health that they would have never considered, jails they would have never considered, and how to really approach these individuals as humans when they graduate and are providers. And I'm offering this as an opportunity at the state level for organizations to partner with universities, because we need our students in settings like this, but it's expensive for us too. I mean, so when we talk about funding, we need our faculty funded, because for every one faculty member, we've got 4 students working with them. So you've really expanded the bandwidth. And we're critical thinkers. So when we're at that clinic, we've begun to realize the needs of the individuals. And some examples are, we're going to start a needle exchange. We're applying, and we're going to begin doing that this coming year. We're doing HIV testing. We realized the hepatitis C epidemic because of injections. We're now doing hepatitis C management. We're now realizing the wounds that individuals are succumbing to because of their tranq injections. And so we're now starting a wound management in the clinic. So we're keeping them out of the hospital, where we have a robust behavioral health program, where we're beginning our counseling. I mean, so as you think at a state level, each region has a university, each region has a nursing program that's hungry for this kind of opportunity. We need to fund those nursing programs to get the faculty into those clinics to run these free and charitable clinics, because many of our clients are uninsured, will never be insured. They have barrier crimes, they'll never have Medicaid. Some don't even have IDs. Where are they going to go?
This would actually lend to, furthermore, the opioid clinics. You cannot get help without identification, and neither can you get MAT treatment without paying for it up front, which is costly. At the last time I worked there, it was $16 a dose, and that's 7 days a week, 30 days a month, and so forth. And some will not be insured. There's just a lot of barriers for those who may seek help, but the barriers are going to close them off from help. And these are the ones that are most vulnerable and often homeless.
Sorry, I don't mean to overtake the conversation, but I did want to let you know that part of the SOAR program, we do help provide funding for people that want to get on MAT, either in our Restore program or with the Virginia Beach Methadone Clinic. So please just have them contact the Warm Line or my phone number. I'll give you my card after this.
This is how we learn too. Thank you.
Absolutely.
Thank you so much.
Cool, thank you.
Hi. Hello. My name is Natasha, and I am a 2023 Minority Fellowship recipient, which provided me a very substantial scholarship for funds. To continue my education, if I committed to developing a plan to eliminate barriers for underserved individuals who have behavioral health and addictions or substance use disorders. My identified population was to increase successful treatment outcomes for individuals who have opioid addictions and who are African American males. I'd like to know specifically what the strategies are to have health equities for minorities, specifically the African American male, and other individuals of color, and how, again, we are getting into those communities to outreach and decrease the numbers of overdose, as those numbers have really increased over the last few years.
Who wants to take this on, Ms. Giles?
Well, I would say that I think it's real important that we are inclusive, Natasha, in regards to our development and our treatment of the individuals and planning for services. So I know that initially when we first started in regards to these fundings, we did multiple focus groups to try to incorporate our community and people that are impacted by this epidemic. We will continue to make sure that they are a part of the planning and development through having individual meetings and focus groups and community outreach and awareness activities. I know that 2 major events we want to have within the next year is that community awareness and involvement activities that we have planned and we've earmarked to be a part of the planning moving forward. So those are some of the ways in which we will try to make sure we're including in representative of our citizens here in Virginia Beach by including everyone in the development and planning process.
Awesome. And can you just touch a little more on the homeless population as well?
I would say with the homeless population, we are working very diligently with our community partners, trying to work collaboratively, outreaching areas in the community where we've identified there are incidents of someone overdosing or multiple people overdosing. Also trying to increase peer involvement, working with our emergency departments, working with our EMS departments, working with our police departments as part of our crisis continuum, having counselors and peers that are responding to individuals in the community to meet them where they are in the community. So I see that as well as part of how we will make sure we're trying to reach everyone equitably.
Thank you.
Thank you.
Good afternoon. My name is Carrie Kruk-Borisov. I'm a human rights coordinator with the City of Virginia Beach in our Continuous Quality Improvement Department. I've been with the city for 15 years. I'm an art therapist. I graduated from Eastern Virginia Medical School 20 years ago. And I started my career with the City of Virginia Beach at the Recovery Center, our Crisis Stabilization Detoxification Unit. And for 6 years, I was the second shift leader. We had a robust and wonderful relationship with the first responders, CIT officers, and a lot heavily from Precinct 2. So we enjoyed that relationship. We used our community partners as we needed to, which was frequent. One of the question marks that we always had was about our individuals receiving services in emergency rooms and in hospitals, and about that connection, and that relationship was not as robust. Lots of question marks there. One thing I didn't see and I'm curious about is a relationship or active partnership with Centera, some of our larger hospital units across Virginia, at Tidewater Emergency Physicians, some of those things to get some partnerships, some resources, some programs, connecting those pieces. Because I think when people do need, to Earl's point, you know, with detox units not being as prevalent in our area, that we do have to utilize those medical systems, and the lack of, you know, understanding or patience or support or compassion or peer specialists in those environments can leave a different experience for individuals seeking help or choosing not to seek help. So I was wondering about that, about partnerships or linkage with Centera. The other thing I was wondering about in regard to, you know, similar fashion, a two-prong approach is about physician development and education. I am adjunct faculty with Eastern Virginia Medical School in the Art Therapy and Counseling Department, but I am aware that Eastern Virginia Medical School is joining with ODU. And I think there's an opportunity with Eastern Virginia Medical School, I've always believed that, to create some pathways into community behavioral health medicine or into addiction medicine by working with those directors, working with those doctor educators to incentivize or to prioritize addiction science, addiction medicine, for nursing development and for physician development was being said before. So I was curious about those pathways as well. And just as a note, we are aware, in my role with the City of Virginia Beach, we are aware of a crippling staff shortage in mental health and in particularly with nursing. People that kind of work in substance abuse tend to be called to it for some reason or another. It is a difficult career. It is very difficult, you know, mentally and physically, but it is also one of the more rewarding enterprises as a helping professional. But just wondering about, in Virginia, I know that across the board, not just in substance abuse, but also in behavioral health and also in developmental services, we're losing our staff, our workforce, which is causing ripple effects in our communities. So I don't have answers. I don't know that the team can come up with answers for that, but just an awareness that it usually lands on the backs of a few people to manage the many. So just some thoughts about anything for staffing and tracks out of graduate school into a career path, that kind of a thing for licensure and certification. All of those kinds of things might be useful to create new pathways. Those were my
Cool,
comments.
thank you very much. There's a couple of really big issues there. I don't know, I hear you on the cooperation and on the staffing issues. We'll turn to a representative from Centera here in just a moment, but I want you to know that everybody agrees with what you just said. This event today is being hosted by the City of Virginia Beach, but before this meeting, we had, I believe, all the regional partners from, I'm going to miss somebody, Chesapeake, Portsmouth, Suffolk, Norfolk, and Virginia Beach around the table saying, how can we all work together? And I want you to know that Centera was at that table saying, we're the largest hospital company in Virginia in general, and especially here in Hampton Roads, we've got a special responsibility to be part of this. So let's hear from one of our representatives from Centera who tells us what they're working on.
I'm Carrie.
I'm Nedra. Hi, guys. I'm Nedra Moncrief Craig. I am the System Director of Behavioral Health at Centera. So to answer your question, the relationship with some of the schools, Centera does that. As a matter of fact, we are in talks with EVMS resident, Dr. Spiegel, and his group on opening up a outpatient psychiatric resident program where the program is actually managed by the residents at EVMS. Centera will put a psychiatrist that works for SMG, for our group, there with them, but it will be a program for EVMS psychiatry. Centera has been very involved. As a matter of fact, we reached out to our friends and our partners who we love at the CSBs and the cities and asked, can we work together to tackle this crisis that's going on? So how do we work together? And so that's something we've been doing from the beginning, is planning this and how do we work together. Centera started a OUD bridge program in the EDs. It started in Hampton Roads, but we have taken it almost to all of our EDs throughout the Commonwealth of Virginia and Northeast North Carolina, where we have a hospital also. We start treatment in the EDs. We get them a prescription for buprenorphine when they're discharged, but we also have partnered with the CSBs, other providers in the community, and we actually give you an appointment, a date, a time, the name of the provider before you leave that ED. So we are trying to make sure that we partner with enough individuals so we can help those who come into our emergency departments and our hospitals seeking services. So, if you guys have any other ideas, this is a great place to let Centera know also what you want us to do. And we'll partner with all our friends and try to make sure we implement services for behavioral health and substance use. So thank you.
Thank you.
Hey, y'all. First off, what's working? My name is Lynn Taylor. What's working is y'all are sitting here. So thank you very much for doing that. I have mixed emotions standing here because this is very personal for me and it's also professional. So fifth generation Norfolk girl raised over there, also multi-generational addiction. Double winner all the way. I went to Norfolk Academy, I went to University of Richmond, I went to VCU, I had all that good stuff and I drank my way through it and then it didn't work anymore. And so I got sober in May of 2003. Oh, no, but thank you. But what I'm saying is it was a beast. It was a beast, and I'm pretty smart, and I kind of knew the right people, and it was hard. And the barriers and the lack of knowledge were vast. It's fortunate I got into a 12-step program. It's great. Some people don't deal with that, but it's what helped me. It also took me a year to function. I talked to people who are on probation. The probation officer says, go get a job. I couldn't even tie my shoes the first year. So I'm like, how are you supposed to get a job, if you're on probation? And I'm seeing a shift in probation is saying, what can I do for you? How can I help you? So what this did was led me on a journey to, I was part of opening the first addiction practice in the state of Virginia up in Richmond. I cannot tell you the lack of knowledge that is out there, that addiction is not a moral failing and that MAT is not a drug, using a drug for a drug. A lot of education needed, stigma, siloed resources. A hub would be great. You don't know who to call. I appreciate the lady from Centera saying what she said, because I cannot tell you how many times I would have somebody crying because they wanted to stop using, and I would tell them, go to the emergency room and tell them you're going to kill yourself. You get 3 days. See what you can do. The other is, sorry, parents calling me with their children in jail and me telling them, leave them there, because there is no detox. There is nothing for them. They'll be safe. They'll get 3 hots and a cot, and you'll have a good night's sleep. How many times I've said that, I cannot begin to tell you. So what changed the trajectory of my career out of addiction practice was, I was standing in the practice one day, and the most successful lawyer was standing in the lobby, and I go, what are you doing here? And he said, see her? And it was a girl in an orange jumpsuit. And he said, last time she got out of jail, she walked in the parking lot, she overdosed, and she died. He said, I went in the jail and took her and grabbed her by the back of her orange suit and brought her in here to get treatment. That's what I have to do to save these people's lives. So where that led me was, I now work for a company called Indivior. It's a pharmaceutical company with a specific focus on creating medications for SUD as well as mental health. I am specific to the jail and the prison population and anybody involved in criminal justice. And so what my goal is, my responsibility is to get access to treatment to those who are incarcerated. That is a beast, because this is a disregarded population, a dismissed population. And you also have this population has the highest rate of overdose and death the first 2 weeks of release than any population there is out there. Treatment for these people will be cost effective for the community, because if you get them treated and they get out, they go back into the community, they pay taxes, they work, they're not sucking everybody dry, so to speak. The other is, you're going to save lives by doing that. That's plain and simple right there. Anyhow, thank you all for being here. Tony and I've had a few conversations in the past, and I remember one he said to me, he goes, Lynn, we gotta look outside the box. We gotta create something new. And so that's what we ask of you guys to do. Thank you all.
Good afternoon. My name is Mark Stevens, and I'm with Stand Up for Kids. I have Nicole here also with me. Stand Up for Kids is a nonprofit that works with homeless youth, 18 to 24, who are homeless on the streets out here. And for 18 years, I've been dealing with this, getting help for these youth. Tell me that, well, this is not the right addiction. They're on the wrong drug to get help. This money needs to go to everybody who's on addiction. Whatever they're using, whatever it is, maybe it's not an opiate, but they probably started on an opiate and now they're using something else that doesn't qualify them to get help. And then try to get them into a program is impossible. So now you got to figure out how to get them in somewhere. My son is an alcoholic, and to get help, I called 911 and asked for a CIT officer to take him in, because that was the only way to get him help. And then the officers have to sit there for 72 hours if there's nobody there. So they're not helping anybody else. So these are the problems that we're dealing with. And Nicole has stories that she's going to go over a couple of things.
I'm admittedly not a public speaker, and this is very personal, so please bear with me. Many years ago, there was a woman of 2 who was walking into a grocery store to buy dinner for her children, and she took a very hard fall and fractured her pelvis. She went to the emergency room, she went to chiropractors, and eventually she was told to go see a pain management doctor. The pain management doctor started with Vicodin, and then it moved to Percocet, and then it moved to Oxycontin. In November, that woman was me. In November, I'll be 10 years clean off of opioids. I detoxed by myself because I didn't know where to turn. There is a stigma in asking for help. I'm now a professional. I'm the executive director of Stand Up for Kids. I help homeless and disconnected youth. It's what I live, eat, and breathe. But in order to help the youth that we have, I agree with Mark, this money can't just go to opioid addiction. I have 18 to 24-year-olds who are addicted to methamphetamines. I can't find them help. I can't find them a bed. And there is knowingly, or what I'm being told, no medical detox for methamphetamines. Opioids is not the only problem that we have. Thank you.
You.
Hello, thank you all very much for doing this. By being here, it shows that your willingness to listen and hear the needs that we experience in the community that you all have seen, and that's the first step. Thank you very much for doing this. I want to highlight something that I experienced when trying to assist individuals with seeking services, individuals with serious mental illness as well as substance use disorders. As people have mentioned, there is a lack of detox facilities. I've had many individuals come, and in that moment, they're ready, which is what we do preach in the here and the now, and there is nowhere to take them. There is a concern for lack of individuals with lack of insurance, but furthermore, there's also a concern, believe it or not, for individuals with too much insurance. If an individual has Medicaid and Medicare, they're turned down from facilities. I can spend an entire day calling facilities to try to find places for individuals. And unfortunately, some days there's no success. So these individuals in the community need a centralized location to be able to just show up. And through moments like these, I learn. And that's something important to me, to be able to admit when I don't know. Today, I have learned that there's going to be the warm line. I see a lot, and that's something I think the city does very well, is to advertise Narcan use. But what I have not seen is the focus on test strips, to be able to have individuals be able to test it. And now today, I have learned that if they call the warm line, that they can be connected with not only Narcan, but test strips. So I myself, as a single individual, can go out and share that with others. I think it could be helpful to add that to all the advertisements that we see for Narcan, that now test strips and other harm reduction measures will be available. Harm reduction has been known to save lives. And in our area, there are not very many harm reduction facilities. Northern Virginia, yes, around here, the clean needle exchanges, I've definitely taken note that that's going to be happening in 2024 with Penn Ministries. Harm reduction facilities can save a lot of lives. So if we have a place for somebody to come to when they're ready, and if we have harm reduction facilities for when they're not quite at that ready stage of change, I think that that could really help the community.
Thank you so much for that. I just want to let everybody know again, you can call the warm line. You'll talk to me, James, or Angela. We have up to 24 hours to answer the call or return it if we happen to miss it. None of us ever miss it though, but you can't hold us to that. But also, we have successfully got individuals into treatment same day. We both know that there's no time to wait when an individual says, I'm ready for treatment. So please, again, call the warm line, talk to one of us. We will find somewhere to take them or some strategy to keep them safe until we can.
Thank you.
Hello,
I'm sorry, can I take just 10 seconds before we go forward? I just want to take a quick time check. We've been going for an hour and 45 minutes, and I want you to know we're going to go as long as you want to. But folks made a commitment to be here for 2 hours. If folks need to leave, that's cool. But we're going to stay here as long as everybody wants to. I also want to remind everybody, there's sandwiches in the back if you haven't gotten one. There's water outside, I believe, and we're going to stay here as long as y'all want to. I'm sorry for interrupting, please.
It's all right. Hello, everybody. My name is Chris Paul. I'm a peer recovery specialist with the City of Virginia Beach. I work with the mobile crisis response team called Marcus Alert, and we have our own number, 988. If anybody calls that number, you get a CIT trained police officer, you're going to get a clinician, and if they, they're going to get a phone call first and decide what the situation is. Then they get a police officer and a clinician. And then I have lived experience with addiction. I have lived experience with depression. I can usually speak to the person that's having the problem, and they know that I've been there. 988 has not been used the way it is as often as it should. We come there for mental health. We come there for substance use. We come and talk to anybody that needs assistance, and we try and get them, into the process with the city. They can get a caseworker, and they can find all the resources we have in the city and in the community. It's like we have food pantries all over the place. We can help them with food. We have lots of other, like 12-step groups. We have NAMI for mental health. We have a lot of stuff that we all know about that could help people. I OD'd when I was 20 in 1971. I've got 36 years, 10 months clean now. I go to 12-step groups as well, and we help people there. So if you know somebody has a problem with alcohol, there's AA. If somebody has a problem with drugs, including alcohol, NA. We help people every day, and I help people on the job as well. And I do have a calling. I feel like, God spared me to help other people, and we want to help. Remember that number, 988. Thank you.
Thank you, Chris. I also want to piggyback on what he was saying in regards to the 988 and make sure that you all know that we also have a direct number to reach a clinician and get help here in the city of Virginia Beach with us calling 757-656-7755. That too is a part of the 988, but it will get you directly to our clinicians here to try to get assistance. Sure. 757-656-7755. Because that 988 is a continuum of services. It can be from just talking to someone on the phone to having a mobile crisis response team come out to you with a clinician and or peer or two clinicians, or where Chris was referencing, it's a clinician or peer with the law enforcement. Or if you're in an emergency situation that is critical and you're needing an emergency services response or immediate response to possibly seek hospitalization. So I just want you to know that as well as we exchange information.
Good afternoon, everybody. I'll be really quick. I'm Shatada Floyd-White. I'm a registered nurse, and I've been in behavioral medicine substance abuse for over 20 years now. What I want to say is that Virginia has a prescription monitoring program where anytime that someone comes to their provider and they would like a controlled substance, we do go into the system and we can check to see what their history of getting controlled substances are. My concern with that is that it's a prescription monitoring program, but is anybody monitoring it? This opioid pandemic, I'm sorry, not pandemic, this epidemic that we're having, it has so many moving parts to it. And we're so focused on what people are getting from off the streets, but I think we also need to take a look at where these prescription medications are coming from as well. We can look in there, and sometimes when you look into the system, you can see that someone has gone to multiple providers, multiple emergency rooms, and in the last 30 days, they could have gotten anywhere from 60, 90 to over 100 tablets or whatever it is that they wanted. And I'm thinking that is also part of the problem here too. We have a prescription monitoring program, but is anyone actually monitoring that? I don't know if the problem is with the physicians, the different physicians that they go to and they get the prescriptions, or if it's at the pharmacy, but maybe we should look at having some type of stop in that system of when we are providing narcotics or controlled substances to people through the pharmacy, that something does actually pop up and say, well, wait a minute, they just got 90 of these 2 weeks ago. And so that's all that I just wanted to add, that there are a lot of moving parts here, and I think that we should probably try to look at all of them. Thank you.
Cool, thank you.
So if I could just speak to the prescription monitoring program and what's done in special investigations, we actually have 2 detectives assigned as diversion detectives, and they specifically work prescription fraud, whether it's the end user fraud or doctor shopping, or it's the actual prescriber that's abusing their ability to prescribe. And they are also task force officers partnered with the DEA. So we have an active program. Unfortunately, it's a large volume of work, but we do have that in the city of Virginia Beach and the police department, and we are actively engaged, and I appreciate you bringing that up.
And is that's here in Virginia Beach, is that common among the other jurisdictions?
It is. The DEA has task force officers all over Tidewater in the state of Virginia, and they work in the prescription fraud task force, yes.
Cool, thank you. Who else?
Check, check. Okay.
There we go.
So I have a submitted question. It states, I have worked as a guardian rep for an agency. These are individuals that are unable to make medical decisions for themselves. However, we are unable to make recommendations for individuals with SA issues to get treatment for substance abuse. So what can be done to reach these people?
Could you repeat it, if you wouldn't mind? It's a complex issue.
I have worked as a guardian rep for an agency. These are individuals that are unable to make medical decisions for themselves. However, we are unable to make recommendations for individuals with SA issues to get treatment for substance abuse. So what can be done to reach these people?
Who can handle that one? I don't know how to address that one.
I can try to handle a couple of those items. First of all, as a guardian, do they have legal responsibilities, such as a power of attorney, to make those medical decisions? For example, when we go to a scene, there may be someone in the home living with, let's say, dementia, for example, where their caretakers will have the medical power of attorney that can make those decisions for them. And that would be the first step, is does this guardian have the legal means to make those decisions for them?
I recently was made aware of an organization too that the name is, I can't think of it right now, but assists individuals with making advanced directives, which are sort of like plans for when, in the event you're incapacitated, can't make a decision, it says, you know, what you'd like, how you'd like to be treated. So that, and I know peers can get trained on how to assist individuals. I just don't have that training yet, but we do have peers in the region that do have it. So again, I would just get with the peers and see about advanced directives.
And the answer to that question was yes.
Anyone else?
Yeah, I was just gonna, my name's Nate. I'm with Prevention Services of the city. Absolutely love what I do, love educating people about substances, working on prevention. And so that's kind of what we do. And so we're proud of the work that we do. I'm also one of the people who was in the school who helps educate the kiddos who are caught or have some sort of relationship with substances. So we help educate that at Renaissance Academy. Great work that we do there. And I've seen a lot of good come from it. I also want to point out that I'm very grateful for the community that we have here. I moved here a year ago. I lived out west in several western states, and I have never seen a city with so much effort put forward into trying to make change. And I can say that after having lived in many different cities here in Virginia Beach. So I'm very proud to live here. One of the things that brought me here, and something that I see everywhere I go, is there's a shortage, and I don't mean this in any way, shape, or form against any of the cities here, but there is a shortage of social workers, right? And so I saw a New York Times article the other day where it said the mass exodus of social workers, and it shares that social workers, first responders, policemen, firefighters, they're leaving their fields because they don't get paid enough. And I know that that's a harder issue because of the economic times and things that we come across, but it's actually why I had to move. And there was a shortage before I left. I worked at a methadone clinic in the West, and I had 110 clients at one time at the methadone clinic, or medically assisted treatment. And I was darn good at what I did. I loved what I did. But I couldn't be paid enough any longer to be able to support my family. In fact, we ended up having to move because the housing prices went up and everything went up. And we ended up making so little money that we were actually paying money to live there out of our savings. And so we moved here to Virginia Beach, and it's a little better, but I actually ended up having to leave my first job at a methadone clinic because of the same thing. And I got a position with the city, which now has made it so that means are able to meet. But the reason I bring that up is because I've come across it, whether I've spoken with people in every, class of the work of the boots on the ground people, right? And they, we talk about people leaving and not retaining, and a lot of that is because we love what we do, but at some point it might be I understand why some people might leave, right? I'm not going anywhere because I love what I do, but at the same time, it's very rare, I feel like, to find a social worker who doesn't have at least a significant other who works or have a second source of income, because it's almost impossible to live off of one. And I know that that's not just social workers, right? That's everybody with their boots on the ground. And so that's something that our nation's facing overall in many different career fields with that. And I know it's been said where we have people who are facing that, or it trickles down to the people who need that treatment, because even when I was in that other state giving services, there's no way I'm going to see 110 people and give them all the care that they need. There's no way our police officers have enough police officers to get everywhere that they need to be, right? And so that's kind of an issue that was on my mind. But again, I did want to say I have never seen so much effort put forward by a city, by a place, at trying to make our community better. Thank you.
Well, thank you. Anyone else? Well, thank you in particular, Nate. We try to start on an optimistic note, and it's encouraging that we can end on an optimistic note as well. I think this has been a really tremendous conversation. Thank you all for being here. Everybody's got a life. Everybody's got something else you could be doing right now. And yet you made the choice to be here, and that's a really powerful thing. I think we've heard a lot of themes today. Some that I've heard is that these issues of substance use, addiction, they affect everybody at all levels of society, every background, every geography, every part of the state and country. And related to that, I heard people talking about how there needs to be a lot more education about what this is and what can be done, what should be done. And we've really got a whole lot of stigma that we've still got to knock down. We've come a long way from where we've been in the past, but we still got a long way to go. We heard comments about the way that students are treated in public schools when their families are dealing with these issues. We've heard about the interrelatedness of all these issues, right? That substance issues are often connected to housing issues and employment issues. We heard people very eloquently call for greater cooperation among everybody that works in this field. And we saw a couple of great examples of that happening already today. And I personally find that very encouraging among our local governments in Hampton Roads and our business community as well. This last issue is a real hard one. This work is tough. We've heard people doing it professionally, getting paid for it. We've heard from volunteers. Work is hard, and we pay not very much in our country for people that do some of the hardest work that's out there. And that's a thing we're going to continue to wrestle with as a community. And then lastly, I've heard lots of folks say that the addiction issues that we're dealing with in Virginia, opioids is probably the biggest piece, is unquestionably the biggest piece of that, but it's not the only one. And we got to keep that in mind as we go forward. This is, how many of these sessions have we had so far, Eileen? Do you remember? This is the second. It's the second session. Nate, thank you for your comments about how the community is really working hard to drive change on some really tough issues. There's at least a total of 7 of these sessions. Today's number 2. That means there's 5 more coming up around the city over the next several weeks. So stay tuned, pay attention. You got other folks that want to be involved. Tell them about that. And we will continue to publicize these across the community. But I also want you to know that the community here, the broader community, you know, I live in Richmond. I grew up in this part of the state, but I live away. And sometimes when you come around here, it can be hard to know, am I in Norfolk right now or am I in Virginia Beach? Am I in Chesapeake right now or am I in Suffolk? Like, it's hard to remember where those lines are. And these issues that we're talking about don't have anything to do with those political lines between one neighborhood and another. So I want you to know, and I hope you find it encouraging, that the public health community here and Centera and everybody that works in this field is really working together in a way that has not been true in the past, if we're honest with ourselves in Hampton Roads, but that is increasingly true, and that is good news, and it's really encouraging. We got a lot of work to do. We want to thank everybody on the panel for being here. In particular, we want to thank Tony McDowell from the Opioid Authority in Richmond. But most of all, we want to thank all of you for being here. As I said, we all know that you've got other things you could be doing and you chose to be here, and that's a big deal. We're about to wrap up the discussion part of today, but Aileen, you want to tell us what else is available if folks want to stick around this afternoon?
So thank you very, very much. What a phenomenal day, really, truly. Everybody who participated and everybody who gave us their feedback, we really appreciate it. This is going to help us shape the future of services, so it was very, very important that you gave us your feedback today. There are other sessions, as we said. One of those additional 5 is going to be all virtual, just for those folks who may not be able to come out. So they're on our flyer, and I believe that should be in your bag. I want to reiterate a big thank you to all of you. We have lunch for you. You did not eat, you did not move, and we're so sorry about that. You got water, though. We gave you some water, but we have lunch. So please get a lunch before you leave. And we really appreciate your time and your energy and all your work that you do. Again, thank you for coming. Narcan education and Narcan is available for those who want to learn about it. So I'm going to defer to both Stacy and Shelby on where that will be. But for those of you that want that education as well as the Narcan, please stay. Okay? Thank you very much.